Dear aquarist or dear fish keeper, today already are our next fish disease case, and it's going to be about Oranda Lionhead, which is a fish which is much liked in the hobby for those that like to keep fancy goldfish. And this one we had a case with tubercles we found in the organs, and explain you our findings in my case today. And the fish was showing abnormal behavior, was getting weak, fast respiration, and there were some losses every day in a tank, about a few hundred of those around the Lionhead. You see the other one swimming below. But this was the one we examined, and he was very weak and ready for our examination and as a case to present for all of us and also for the fish keeper and the shop who was keeping those fish and want to have a treatment or a result. The first thing we noticed was in the tubercles, we found, in the gills, we found tubercles. See, in the gills, here, 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 and that's not normal, you know. Some of the gills are looking normal, but some having tubercles inside. And that is very seriously. That's why the fish was wasting away. So he couldn't have a proper respiration. Here we see a detail of a tubercle, which is encapsulated in a tissue, and that cannot be reached by any treatment, but it's taken away healthy tissue of the gills. And that's causing, of course, respiratory problems. Here is one more. All that part is gone of that gill. All those lamellae are gone and not used anymore, not available. Here is another one. So that's tubercles in the gills. And when we dissected the fish, the organs had a lot of fluid. Here was a swim bladder, nothing specific was, but there was a lot of fluid in the abdominal cavity. Here you see the watery content of in the abdominal cavity. We saw a lot of black specks all around into the organs, and we saw the kidney here, which was large, very fluid, very loose, and it should be more concise organ. So that's all the things we pulled out of the fish to check in the microscope. And in the organs we found tubercles, as expected, because we saw them in the gills. Well, then you can expect that there will also be in organs inside the fish. See, there's more of these tubercles here, all in the fish available. The kidneys were very bad. There were some calcium formation or blood clots and the beginning of tubercles. So this is all showing that there is no nice red colored kidney, but the kidney which is not properly working. And then at the same time, the gills are not properly working. You can imagine that the fish is suffering badly. So what could we recommend in a treatment for a fish like that? Well, the fish that suffer badly, you know, a treatment will not help. You better put the fish asleep because we acted too late. We saw it too late. But this fish, in a batch of a few hundred, sacrificed himself to give us the information we needed to treat the rest of the tank. And the first thing we had to check or ask ourselves, what is the origin? Most likely it is the breeder. Breeders can supply fish, can breed fish, but when the mother fish, the parental mother fish, has Mycobacterium, which is properly in this case, or bacterial infection, it can pass it on through the babies, through the eggs, through the gonads. Another source could be bad food that is polluted with bacteria. And here, most likely, well, like I mentioned, this Mycobacterium, it's first tuberculosis. Why do I think it is most likely? Because it's very common in our aquatic tropical fish industry. It's just common, also in the fancy goldfish. That do mostly came from Asia. Treatments could have little success. Some people try minocycline, oxytetracycline, kanamycin. You can check with your vet, but it has no help, to be honest. It's very little help, and it's and using antibiotics these days is under a lot of discussion. You can help the fish with a food. Therefore, we developed the Dr. Bassleer biofish food, Fuko, which is a fucoidan, which has an ingredient that helps in control of internal bacterial infections. It's not a medication, but it's like a phytobiotic, a plant that helps the fish to control the bacterial infection. So I hope this information helped you in this case of the red lionhead. More cases to come on other fish. What's going to be next? Well, you will see in case number 62. Thank you for watching.